All right, good morning and welcome to our weekly press briefing, COVID press briefing. We were here last week. We're certainly here this week, and we will be here next week as well. I'd just like to start out by welcoming Kirk Carlson from Bowen Center, our testing partner, Kosciuszko County Commissioner Carrie Groninger, and our health officer, Dr. Bill Remington. Obviously, we'll talk about our numbers today, talk about vaccinations and our trying to accommodate our testing as I think things are still at a level that we would not like them to continue at. So, Dr. Remington, I'm just going to let you dive right into the numbers, and let's start out that way.
Well, thank you, Mayor, for inviting the Health Department again. We'll start off with cases and vaccination stats and then some emerging talking points. So cases continue to go up in Kosciuszko County. Our first case was March 26, 2020. We're now over 11,000 cases. We're up several hundred from last week. 134 deaths, which is 3 additional deaths in the last week. We remain at the State Department of Health's orange advisory as a county, which is where we were last week. We have a slight increase of positivity. We're at 13.3% compared to 12.5% a week ago. At our worst in November, we were 26%. Our daily average of new cases was around 27. We were at 44 a week ago, so a little softer. Quite a bit less than what we saw at our worst in November at 134 new cases averaging daily. Our weekly cases per 100,000, as per the State Department of Health, an important metric with that color advisory, is higher than last week, 390 weekly cases per 100,000 compared to 318. The CDC's color-coded map is all red across the country, including Kosciuszko County. They consider a high transmission rate at greater than 100 weekly cases per 100,000. Again, we're at 390. Indiana hospitalizations are up. That's a striking graphic on the state dashboard, probably the one that's most sobering to me personally. We're getting close to where we were at our worst early in December last year. We're at close to 2,700 hospitalized patients in the state of Indiana. We were around 2,500 last week. 7-day moving average for Indiana for deaths is about where we were. Is up a bit from last week. We were at 9. We're at 23 now. At our worst in November, it was 100. So, again, as you've heard me mention, the deaths are a lagging indicator, and that lagging indicator is now climbing. Vaccination stats across the state of Indiana and Kosciuszko County remain disappointingly rather muted, I would say. 6.4 million doses compared to 6.3 million doses across the state, so up just a little bit. We've additionally immunized a little over 300 patients in Kosciuszko County compared to a week ago. We're at 42% immunization rate for 12 and older, and I think the 18 and over metric is around 45%. So it's about where we were a week ago. Emerging discussion again continues regarding the reframed quarantine directive in fully masked schools, which this health department fully supports. Wear a mask, stay in school. I can't emphasize that enough. We do not have a robust immunization rate in this county. There's lots of community transmission, a lot of community transmission. The only way these schools can stay operational, in my opinion, is to be fully masked, which reframes quarantine, or they totally disregard quarantine directive as promulgated by the state administrative code. And I don't have a whole lot of patience for that. If we did not see the disease burden we see now, this terrible hospitalization graphic across the state, including this county, I wouldn't speak like this, but we've got to take this seriously. Schools are, like it or not, an epicenter of public attention. It helps frame how we look at this in a county perspective. Schools that have no desire to report cases or quarantine contacts in an unmasked environment is malpractice. in my opinion. And I hope the state finds a way to combat that. Wear a mask, stay in school, and let's stick with the desire to follow the state's guidance, the governor's executive order, which emphasizes the communicable disease rule, Indiana Administrative Code, which asks us, demands us in schools to quarantine appropriately. Warsaw Community Schools really took it on the chin to go the direction of a fully masked school. They were absolutely correct. I fully support them and from a public health voice, and should, I think, be a great example to other schools in this county to look at. It's not the kids that push back against the masking, strangely enough. It's the voices of their parents. The kids will fall in line. Parents just need to encourage it, that's all. That's all we ask. Look, you wear a shirt in a restaurant, you wear shoes in a restaurant, we ask for a mask in schools. What can be so hard about that? It's a public health directive. It won't be forever. It's for a period of time to see us through at least this significant wave driven by the Delta variant. So kudos to Warsaw Community School Corporation in making a hard call. And I hope the others step up. Vaccines continue to provide the strongest protection against COVID. Less than 5% of hospitalized COVID cases are immunized people. Vaccines are highly protective and they're safe. We should immunize. In some facets, I applaud a vaccine mandate. I'm ready to get there. I'm tired of this thing. Tired of seeing deaths, hearing phone calls from people who've lost loved ones. We can do better than this. If it takes mandates for corporations to get their employees immunized, all for it. It's not going to hurt you. Rarely is someone bothered significantly from a vaccine. There are breakthrough cases, no doubt. They're disappointing, but vaccines are still highly protective. Those immunocompromised should get a third dose of one of the messenger RNA vaccines now. The booster guidance is still getting batted around a little bit, but I think will be coming very soon, and that'll be for the rest of us who are not considered immunocompromised. At the health department, we continue to offer and promote COVID immunization. We have our vaccine staff busy with maintaining robust immunization rates with young children regarding all other pathogens, but we are still there Monday, Wednesday, Friday from 8:30 to 10 offering COVID immunizations. We have all three vaccines. You can choose which one you want. We've been facilitating mobile clinics. I think Grace College just had one. Our Lady of Guadalupe has their second one this weekend, and I think one of the local employers, Warsaw Powder Coating, has one coming up in Etna Green. So immunization is still our strongest way out of this. Go to rshot.in.gov or call 211 or walk up either at the health department or the pharmacy. Get a dose in your arm. It's the best thing to do. And so I'm ready to end this thing. I don't know about you, but I'm ready to end this thing. If the disease burden wasn't what we see, I wouldn't care about the cases. We'd think more like we would with influenza. But we're not there with this. And we're going to be in this surge for a few more weeks, I think. So schools got to get serious about this. The case burden in our schools is significant. I was on that part of the state's dashboard this morning. There's plenty of cases in our schools. The only way I can see that they're administratively getting around this is not being too serious about quarantining, and that's a shame. Thanks.
All right. Strong words on vaccinations.
Absolutely.
I just did a little bit of math. I know you'd mentioned that about 42% of the county is vaccinated of those eligible. Looking at the total population, the county population is 79,456 with 28,290 fully vaccinated. Shows our total population at about 35.6%. I just heard this morning that St. Joe County's fully vaccinated total population just hit 50%. And it's really important that we, I think one county up and over, if they can do it, certainly we can do it. We're providing opportunities. I know the shot clinic is now available on Monday, Wednesday, Friday. Do you remember the hours?
Yeah, it's at the health department, it's 8:30.
8:30 to 10?
To 10, thanks.
Okay. And we talked about Our Lady of Guadalupe. They'll be providing the second Pfizer shot this week. They will also be taking walk-ups for the first shot. Again, this Saturday at Our Lady of Guadalupe from 10 to 2. Second shots will be given from the clinic a few weeks ago. But most importantly, an opportunity at a mobile drive-through site to get vaccinated. And if you can register, that helps us, watch our doses so we don't waste any. But we will nonetheless be taking the walk-ups out at Our Lady of Guadalupe. I think before we started this morning, we were having a discussion, and Dr. Remington, you just talked about the importance of epidemiology and numbers, and I just thought, that's what we've been doing from day one, and we're still fighting that same battle, trying to get those numbers to finally align. And a lot of times there's things we can control with the numbers, and a lot of times there's things we can't control with the numbers. But getting vaccinated and getting to that point where we can cut the transmission, the local spread is that's really what's driving the variant formation, more transmission, more replication, more variants. And that's why we're where we're at right now. And, this is the one thing we can control. Each and every one of us can control. I know there's individuals that have reasons for not wanting vaccinations. I don't feel like we beat people over the head with it, but the vaccination is approved. It's fully approved, and it's as safe, it's as researched as you suggest. I think what we have to be fearful of is not being vaccinated rather than being vaccinated. So, Kurt, I'll pivot to you. I think, again, talking numbers and epidemiology, you're seeing it on the front lines over at the testing site.
Yeah, thank you, Mr. Mayor. Thanks for holding this press conference. Again, as I'd mentioned, we surged up to about 200 and some a day, caught us flat-footed in terms of staffing. So we've been staffing up. Like we all know, there's a lot of reluctance for people to return to the workforce, but I think we're fully staffed now. We have the last person we hired will start, I think, later this week. So when I'd heard that we had some people waiting as long as 4 hours to get tested, that was absolutely unacceptable. So we staffed up as quickly as we could. We're now averaging for the last 2 weeks about 160 tests per day. Most of those are the rapid tests. I know Dr. Remington and Bob Weaver wanted to know how many people are showing up symptomatic. So we've now started to keep that data, and it's averaging over the last week 37% are showing up with symptoms that could be COVID. The number of Hispanic clients coming to the center has, for reasons I don't know yet, but I'm going to ask, and that's down to about an average of 8 a day. And at one time, we were averaging about 1/3 of the people coming to the test site were Spanish speakers. The number of kids has gone up as school has reopened. And so we're seeing more kids than we had in the past. And still the trend of 11 to 20-year-olds and 21 to 30-year-olds are the highest number of persons coming to the test site. I guess when President Biden started talking about mandates for government employees, hospitals, healthcare facilities that receive Medicaid and Medicare, I really thought that we would see more opportunities for people to see that they had to get the vaccine. And now I'm hearing that Governor Holcomb and Todd Rokita are opposing that. So it's a bit discouraging in a way. We've seen now a former Bowen Center staff member pass away from COVID within 10 days of hospitalization. We see one of our patients is probably near death from COVID. It's just discouraging when it gets that close. These are people I've worked with and people I've served. And we just do need to get the vaccines, and both of those individuals were unvaccinated. I was just in Boston, and Massachusetts mandated the masking, and I did not see anybody in a building that was not wearing a mask. Yeah, I was looking for that to see how compliant people were. It looked to me to be about 100% compliant. And again, I think masking and vaccinations are what we need to be doing. So that's again, the hours. I know the mayor usually like me to mention the hours. So we're now up to Monday, Wednesday, Thursday, and Friday, 9 to 3. Tuesdays, so that we'll have some evening hours, 12 to 6, and Saturdays, 10 to 2. And I'm aware that if there's still a line at those hours, we don't close the doors. We serve the people in line till the line is gone. And so some of my staff have put in hours far beyond that just to make sure that we're serving the people who need to get tested. And then they stay a couple hours after that, finishing up, putting in the data. So some of these people are putting in some long hours, but at least it's a little less stressful for them. They were running when they were short-staffed, and now being fully staffed, they can keep up the pace.
Thanks, Kurt. You know, as you're talking, I was looking down at some of the statistics Dr. Remington gave us, and if you look at the number of hospitalizations, you look at the hospitalizations, less than 5% of hospitalizations are for breakthrough cases. In other words, folks that have been vaccinated. Dr. Remington, you want to comment a little on that? And I've seen that the death rate is even far less than that for those that have been vaccinated.
Yeah, I did bring a little more discussion points regarding the whole breakthrough thing and the protection offered by immunization. A lot of this is through guidance we've had through local health departments working with the State Department of Health. They have a graphic showing hospitalizations vaccinated versus unvaccinated. I didn't bring that for all of you to look at. It's a striking graphic. It's very clear that hospitalizations occur many times fold greater in unimmunized people compared to vaccinated people. You do see hospitalizations with previously vaccinated people, you do, but they're a minority. This is from the CDC's Morbidity and Mortality Weekly Report on, I believe it was September 10th. This is what they will quote. Infection is 5 times, this is during the Delta period of time, okay? This isn't aggregate back into Alpha. This is just Delta, which we know is a really wily coyote, right? The infection rate is 5 times greater in unimmunized compared to vaccinated. Hospitalizations are more than 10-fold more likely in unimmunized compared to immunized. The death rate is greater than 10-fold in unimmunized compared to immunized. Striking. There is definite reduction of disease burden and uncoupling, you'll hear this quoted, an uncoupling of death from cases if you are immunized. You may not have perfect protection against a case, we understand that, there are breakthrough cases, but you are greatly protected against the worst hardship provoked by a COVID infection. We should embrace it. We really should. Thanks.
Thank you. Carrie, anything from the county standpoint? I know you've been working hard with the health department to make sure that we're keeping up, and just your thoughts.
I know that Bob's been working hard with the state, making sure we've got all the testing. I know they got a big supply in this week, which is good. I'm a little concerned whether or not there might be a shortage just because of the amount of testing that was going on around the state. So clinics continuing to stay open for hours, and I think there's plenty of vaccine out there for those who personally choose to want to have the vaccine, so.
Okay. All right. One other thing I think needs to be articulated. Dr. Remington, you'd mentioned that the county will stay in the orange as of noon today when they update the Indiana map. I know you'd mentioned CDC has a different advisory level, if you will, but I just wanted to articulate that what we've been following from the state numbers and the way they figure the advisory level, we will continue to stay in the orange. Any comments on that?
It is a little confusing, right? There are a different set of lenses on what you consider high transmission. So the CDC, if you look at their map, it's red all across the country, including, you can hone down on Kosciuszko County, you'll see that we're red. We're greater than 100 cases per 100,000 per week. So that's different than how the State Department of Health uses a color coding. So we are orange in the State Department of Health's color-coded advisory, even though we're at close to 400 cases per 100,000 per week. So this is, I would say, a highly transmissible environment that we're in by anybody's definition. We will pivot from a turn to a State Department of Health red advisory in this county with stronger language from my office regarding masking and indoor venues particularly, if we go red by the state's designation. We're orange. So we're still working phone call by phone call with people who have upcoming events, trying to find the sweet spot for them with the approach to keep their event operational, if that's what they choose. But we will pivot to a little different language should we go red by the State Department of Health's color advisory.
Okay. Gentlemen, anything else before we open it up? Okay.
Okay, well, you mentioned a little bit about hospitalizations.
Mhm.
Last couple of days, I've had some older people call concerned about hospitals being at capacity or diverting patients. I guess locally, what's the hospital status?
Yeah, so as far as I know, our local hospital is continuing to do semi-elective cases, hips and knees, colonoscopies, that kind of thing. They have a high volume of COVID cases right now, I know that. And they need additional staff. And there are reports, just from what I've heard from the State Department of Health, of many areas across the state that are on, that are diverting care because of bed capacity problems and staffing problems, and also closing down some of their semi-elective procedures for a period of time. So here we are again with that. But locally, I think they've been able to cobble together the staff and beds and trying to do all the routine business at hand that hospitals need to do with non-COVID things. But that capacity, I think, is teetering on the edge. That's why I've been that particular understanding is why I'm so strong in my positioning towards vaccination, even being warmer to vaccine mandates and fully masked environments indoors, particularly with schools who have a quarantine directive to obey. I think these are important issues. Once the disease burden softens, our temperament and tone can be different. Again, it all springs from the epidemiology, and particularly the disease burden. If I could, just a little commentary. I heard, just flipping around some national news outlets the other day, some discussion that perhaps hospitalization rates have been overplayed. Somebody had an article in a prominent newspaper about that. So I don't know. I don't know how much that hospitalization rate has been overstated. But it doesn't make a whole lot of sense to me when I hear of diverting care, people screaming for staff support, needing to shut down the things that hospitals need to have done, elective hips and knees and colonoscopies and all that. It doesn't make sense to me that they would be overstating their hospitalization rate from COVID if that's the resultant behavior. You know what I mean? What hospital administrator would do that? So it's a real thing. I mean, the disease burden from COVID is real. Maybe there's some room to quibble as to what the exact hospitalization rate is, but I'll tell you, it's high. It's palpable, and that's coming from a seasoned clinician as well as a health officer. The voices I'm hearing, the anecdotes, the testimonials, the metrics, this isn't fabricated. Okay, it's not inappropriately extrapolated or expanded through a megaphone. It's a real issue. I've never seen anything like this durable as a clinician. I've been doing this for over 30 years. Okay.
Dr. Remington, you talk about hospital capacities and beds and so forth, but we've also been made very aware from the mental health side that hospital workers are getting really weary, and hospital workers are leaving the profession. And not only is the bed capacity a problem with increased number of patients coming in, but the ability to handle those patients when hospitals are short-staffed, working overtime, and you've got people that are just finally throwing their hands up. They see what problems, what health problems this thing causes, and I see when they see people coming in with that high hospitalization rate of those unvaccinated, it just seems like they're not getting anywhere. They're just spinning their wheels.
I think you hear that just in the testimonials you see on the evening news with healthcare workers, that disheartening affect as they take care of yet another patient stuffed in an ICU bed, not doing so well, that was not immunized. I mean, that time after time after time. And as the calendar rolls on month by month and we're still doing this, it takes the air out of your sails just a bit. It feels preventable to them, and I would say it is.
Just to clarify, are you aware of any cases being diverted from KCH?
I am personally not.
Okay.
Now, EMS, from time to time will tell me of anecdotes with diversionary motif. That comes dynamically, even independent of COVID. And so I've heard some stories that I don't sense that is largely occurring locally now, that there is absolutely no bed capacity. Whether our ICU is 100% has no further room, I really don't know. I can't comment on that. So.
Your criticism with schools that are not reporting, can you tell us, do you know the status of all our local school
I don't
districts?
perfectly. Some have wanted to engage with me, others not so much. I get it. They're playing to their constituency, I think, and their boards. I have been hearing some anecdotal, some conversations regarding what I consider oppositional behavior toward state quarantine directive and even perhaps reporting. If you're not reporting, you're not going to have somebody noticing you're not quarantining. So I think most of the schools in our county are reporting technically. What the state will decide to do as far as teeth towards schools that are not really quarantining as they need to is unclear. I know it's an active discussion with them. They see it as an Achilles heel of the model we're in right now, and they're looking at avenues to come at those schools. So heads up to those schools not doing that. They may be coming to get you. Won't be me personally, but the state may be coming at you.
In your remarks earlier, you sounded pretty frustrated and maybe even a bit angry. Is there something in particular that kind of...
Well, I think it's the disease burden, quite frankly, the hospitalization rate. And the anecdote is being a doc on the street, just hearing more bad cases, deaths, and people very hesitant to be immunized, very resistant. And the parents oppositional to mask mandates, which are meant to further the cause of keeping schools open and protecting students while they're at school. I don't have a whole lot of patience for that. Where, as I said again, you wear shirts and shoes in a restaurant. What's with the mask? What's with the mask at school? I don't get it. Come on. Parents can set the tone in their households for that. I'd say it's time for them to be thinking of the big picture. We want these kids in schools. We want it to be a safe environment.
You mentioned vaccine mandates earlier, and yesterday I heard, maybe it's just a rumor, that the city was thinking of going to a vaccine mandate because it have over 100 employees. And I don't know if that's true for the city and if the county would consider a vaccine mandate for its employees because it also has over 100.
I don't know where that conversation came from, other than if there's a federal mandate for employers with 100 or more employees. Obviously, we fit into that purview. Does that mean that'll happen? I can't tell you. I would go so far as to say I think everyone should be vaccinated, but I am not for vaccine mandates. And that doesn't sound like sounds like a fairy tale, quite frankly. But I like to try and appeal to folks how critical and important this is, and we're in a situation right now we're not seeming to get out of. And there's again, that's one metric we can control is our vaccination rate. That's one metric that individuals can control, can put their slash on the board. And I understand that people have concerns, legitimate physical concerns, and I understand that there are certainly religious concerns. But I just feel the politics should be taken out of this thing because the vaccines are safe, they work, they've been fully approved, and again, this gives us the opportunity to get out of this. But as far as the city mandating to its employees, the city won't do it. The federal government is trying to do it, and I don't know how far that's going to go, to be quite frank with you.
I don't see the county following or doing any sort of a vaccination mandate. We're a little more conservative. But, for those that want the vaccine, we're here to fully support that and make sure we have all the vaccines available and everything out there for people that want that. And I know that I agree with it works and we need to try and stop this, but to force somebody to do something that's a personal choice that they don't want to do, I struggle with that being the government's job to tell you whether or not that's, and almost penalizing you on where you're going to work or where you can and can't work based upon whether or not you've been vaccinated.
But I guess kind of a follow, if the federal government does for vaccine mandate, with these, and there were some employee decided that they're not going to do it, they quit. What kind of problems or issues would that present to the city, county, or I guess the what if situation? What if it does come down? We must do it, I guess.
I think it's kind of early to try and project that. From the federal government standpoint, the questions being raised now are, is this legal? We don't know that. The second thing is, if indeed they institute something like that, how are they going to enforce it? I'm hearing, I think initially something came out about I don't know where this number came from, like $14,000 fine per occurrence. No city or town or county wants to face that, okay? But again, I don't know where that's coming from. Those are questions that all need to be answered before we can get into certainly there will be no mandate for city employees to be vaccinated until this thing is come, the rule doesn't come out till I think September 24th. So to ask me a question before then isn't fair, because we probably know about as much as you do based on what was said at the federal government level. But the rule itself will come out September 24th, and I imagine there'll be a host of legal challenges. And I think I would certainly agree with the Commissioner. We're not going to be standing in line to go on our own when we're not sure where this thing stands. In the same breath, I would wish that we wouldn't need any kind of mandate. I don't personally advocate a mandate. I feel like we should all try and take some responsibility to make a difference in a way that we can. And, that's being vaccinated.
Do you have any idea how many city employees are vaccinated?
I don't.
Is that a HIPAA issue?
I don't know that it's a HIPAA issue. Someone can go into a pharmacy and get vaccinated, and we don't get those reports. We've got health insurance, city health insurance, and a majority of our employees are on city health insurance, but unless they go in and actually file for that vaccination, those giving the shot file a claim for that, and that's the only way we know.
Yeah, we've not tried to collect any of that data as far as number of employees that are vaccinated.
And Dr. Richardson, you mentioned about events. Going forward, if someone's thinking of having an event, what should they take into consideration about planning or contacting?
Well, our community transmission is high, and indoor congregate spread is a well-understood motif with this pathogen. So we're happy to advise them, phone call by phone call. Just call Mr. Weaver at the health department. We would encourage strong consideration to a masked environment. We would encourage high immunization rates among patrons at events. Try to set up an event to spatially separate people as best you can. We're not at the point where we're strongly advising cancellation of events at this point. I think if we go red, we'll have to wrestle with that topic. It's hard to find the sweet spot in this whole conversation. You can hear the dynamic nature of this. You never play in a vacuum in public health. It is much to do with the population's willingness, really, at the end of the day. So these are dynamic discussions. We don't want to see businesses fail because of the pandemic. Restaurants really took it on a chin a year ago. We really don't want to have to revisit that. And we want to try to, get back to life as normal as we can. We do. We all do. It's important for us, for our psyche, right? We're social beings. We need to be social. So finding the sweet spot in that conversation is challenging for all of us. We will continue to spring from the epidemiology. I mean, that's kind of our voice. Kind of nerdy-like, looking to the data, knowing our population, trying to find the right voice as we look at that data.
Just another note I guess I'd like to add, just from a perspective of, you know, the individuals that are up here and the staff that we have behind us, our support staff, I mean, we all care about our community. Do we always see eye to eye, and there may be some differences there, but that's what makes this community great, that we can have discussions and influence one another on what we feel as though is best for our community. I think we have a really conservative base here that's a little tougher to want to mandate something, just because when you tell somebody they have to do it, they tend to just not do it because you told them they had to. So I think there's that fine line that we're all up here walking, doing our best to try and navigate through some uncharted waters that we thought we'd sailed through one time before, but it seems like this Delta variant is definitely a little different animal. And you know, I just appreciate all these gentlemen that are up here and the point of views that we have, and we just want to continue to work together to find common ground of how we can serve our community well and get us through this. And, you know, there is light at the end of the tunnel. This too will pass. You know, Mom always said there'd be days like this. So, you know, we have to get to the point where, you know, we're back on track. We thought we were there even just a month ago. Things were a lot different. So I really appreciate, you know, the opportunity I've had to serve with all these guys up here to trying to just navigate these waters that, you know, you're never going to make everybody happy. I mean, you've got the side that's thinks one way, but I guess the big thing I see is being able to have conversations and share our ideas up here is just it's been a good process. So.
You know, I just want to make a couple other comments. I totally agree with Carrie. All I want to say is we're all trying to do the best we can. We've been playing the numbers. We've been playing the numbers the whole way, and as far as I'm concerned, that's all we've been doing, because that's all we can do. And again, it's numbers, it's levers, it's trying to squeeze this thing out, and there's direct ways to do it. The other comment I wanted to make on this federal mandate, it's my understanding that the federal mandate will go through OSHA. So to me, the rules that come out and the enforcement mechanism will be through OSHA. Again, when the final rule comes out, I believe it's September 24th, which isn't really that far off. It's 15th today. Certainly, you know, there may be more questions, and then again, post that the legal challenges. But that OSHA rule is how the federal government plans on enforcing and imposing these rules on health and safety of the workforce. Kurt, mental health wise, I know I don't think we should ignore that impact. I know you're the front lines in this community. Besides the testing, also some of the issues and concerns, all age groups, it's really been a strain. And again, that's the kind of information that all of us up here that's just one more piece of information that helps us try and make the right decision for the community. There's so many things going on. Any comments?
Yeah, this has just actually come to my attention lately about persons dropping out of the workforce because they can't juggle the kids quarantined at home and keep their job going. We have staff who are using paid time off to do that. And then come the holidays, it's going to be unpaid. And so that creates financial stress. There's this rock and roll back and forth of, quarantine, masking, sick, not sick, neighbor sick, other students sick. It just wears on people. And, here we are in our second year of this, and that's creating a stress. And it's not just with our staff. And my daughter's a nurse, and again, it's creeping up. This in the Chicago area, and I mean the toll it's taking on their staff, the nursing staff, as had been described earlier, is just very real. And hearing people dropping out, they just can't do it anymore. And some of her colleagues have done that, have just said, I can't do nursing anymore. and dropping out of the field. And we already have a shortage of nurses and caregiver staff, and it's just compounding. So this is even persons who themselves aren't sick. It's this secondhand stress that they're dealing with, and trying to keep their family safe and keep employed. And when they can't, that creates a problem. So, yeah, it's just so many layers, so many different ways it's having effects on people.
All right. Any final questions, gentlemen? All right. Carrie mentioned all the men up here. I also want to make sure we don't forget
Yeah.
Jeannie DeWild and Teresa Reed at the County Health Department, who are not gentlemen, but gentlewomen, and do marvelous, marvelous work. As you said, standing tall to get things done. And I know Teresa works very hard, and I know Jeannie works equally hard. And just to round out those kudos,
Yep.
I knew that's what you meant.
Yep.
So we'll be back next week, same time. And if there are no further questions, thank you all. And please, if you've got the opportunity to visit the vaccination clinic Monday, Wednesday, Friday from 8:30 to 10. And then this Saturday, there's a walk-up first shot clinic with the Pfizer vaccine out at Our Lady Guadalupe. All right. Thank you all.
Thank you.
Thanks. Dr. Remington?